completely out of the system. Now your system remains with only hemoglobin A or hemoglobin S. But hemoglobin F, which normally makes it difficult for somebody to know whether you are anemic or not, is very high with children under 5 years. That is why it is not easy to detect. Hemoglobin F is helping them. Now symptoms may appear minor but vague. In its visible stage, it shows feeling of weakness, fatigue, and general malaise. We have two types of anemia. We have extravascular hemolytic anemia. I'm going to explain that, don't bother. We have something called extravascular hemolytic anemia, and another one is called vaso-occlusive anemia. So vaso-occlusive anemia goes with the veins, but extravascular goes with the arteries. We are going to see as we continue. Now, I'm giving you some symptoms for extravascular anemia. Number one, you will have general body weakness. You will have fatigue, poor concentration, shortness of breath, increased cardiac output, palpitations. You can suffer angina pains. You can have claudication of legs. Heart failure can occur. Deformities of the body parts, leg ulcers, fast heart rate, behavioral disturbance, consumption of non-food items like wax, dust, air, or even plastic, impaired neurological development in infants, restless legs, reduced scholastic performance, pale skin, may have conjunctivitis, may have jaundice, or bone fractures, or weak bones. Those are some of the symptoms for the hemolytic extravascular anemia. But there are two main components of anemia. Anemia due to breakdown of red blood cell or blockage of the blood vessels. Breakdown of the blood cells or blockage of the blood vessels. For example, there is great danger in decrease of oxygen supply for people suffering from this problem. Why? When there is low oxygen in the body, hemoglobins coil. I will repeat that. When there is low oxygen in the blood, hemoglobin makes the red cells to coil. When they do so, they undergo deformities, and that reduces the amount of blood in your system. Parasites can cause anemia due to loss of blood. Genetical or accident, hereditary or accident, poor diet can cause a reduced blood, but not sickle cell. Now we have dangers of sickle-shaped red blood cells. What do? Number one, when there is high concentration of uric acid in the system, there will be production or formation of sickle-shaped cells. When there is low oxygen, there will be developed sickle-shaped cells. Now, what are the dangers of sickle-shaped cells? Number one, they will prevent cells to carry enough oxygen, especially the red blood cell. That maintains the red blood cell. Then the cell dies, and this causes a low volume. I'd already explained that. But when there is good amount of oxygen in the blood, there will be no symptoms of sicklings. The sickle cell set will not be formed when there is enough oxygen in the blood. That means low oxygen content in blood leads to development of sickle cell anemia. That one is very important for you to know. when there is oxygen, hemoglobin polymerizes and large molecule chain of hemoglobin S is made. When there is low oxygen in the blood, it means the system will produce that bad protein. That bad protein is called what? Can somebody help this child? Can somebody help her? She's really struggling to arrange things in order. Good. Bad protein is what? What did I say represent bad protein? We have two. We have glutamic and valine. Which one belongs to bad protein? Eh? One thing which I've realized with the Masinde Muliro University, you are unique. Nimetembea kwa shule za universities nyingi sana in Kenya here. In Zanzibar I had one. But in Kenya several ones. But for Masinde Muliro, you are unique. A unique people, you will never know whether they get you right or they don't. You won't. And they will never speak with you. They will never ask you question. They will never answer you. They let you speak. The only thing that is good with you, you know how to concentrate and you keep quiet and silent. Hemoglobin what? Represent bad protein. Hemoglobin S. Hemoglobin S represent valine acid. Good protein represent hemoglobin A, which is also represented with glutamic acid. Wangapi wanasema sasa tunajua, tutasahau tena. Hata kuinua mkono wamekataa wengine. Bwana asifiwe. So this is what you have to understand. Under sickle-shaped cell, I have said bad protein will polymerize. To polymerize means to form chain, forming a chain of bad proteins. So the polymerization of hemoglobin S leads to sickle cell crisis. A sickler will have crisis when there is a polymerization of hemoglobin S, that bad protein, a condition which will affect the patient much. Factors facilitating sickle cell anemia. Number one, when there is too much production of hemoglobin A, there will be health to the patient. Too much production of hemoglobin S, there is danger to the patient. This is large protein molecule which damages the cell membrane. Hemoglobin S will damage the cell membrane. And when the cell membrane is damaged, it will form sickle. And this will lead to crisis. So that is why they say so. Now, what the other thing means, when the body produces hemoglobin S, there will be too much cell mutation. Cell mutation leads to what we call hemolysis. That is the mass destruction of the red blood cell. One of the factors that facilitates or increases cell mutation is when there is low oxygen. That is when the body produces bad protein, hemoglobin S. It will make that one. Under deoxy, that means when there is less oxygen, under deoxygenation, there will be formation of hemoglobin S. That is why in the hospital, when we get sicklers, first thing to do for a sickler is to ensure that there is enough air circulation and enough oxygen supply. How do we do this? Akija or see immediately, you understand how he or she feels, the state that they are in. Number one, you will begin to transfuse. You will use drips. You add water. Why do we do that? We do that for a reason that you will soon know. Operational sites of hemoglobin are very important, but it depends with you. Wewe ndio unaweza kufanya hemoglobin yako itengeneza bad protein ama itengeneze good protein. Ni wewe tu. The condition that you put your body in will allow your system to polymerize the hemoglobin S or hemoglobin A. It depends with the condition that you give. For example, those who are flesh eaters, I'm sorry to say that. If you're a flesh eater, realize it well. There is a high or increased uric acid because uric acid is the byproduct of meat metabolism. And then another byproduct of meat metabolism, which is very serious, is called the purine. Now, purine and uric acid combined leads to polymerization of hemoglobin S, which will lead to anemia to an extent. So, we have to understand such kind of factors. They are very important. Now, what should we do? When these sickle-shaped cells stuck within the vessels of your spleen, you will suffer what we call splenomegaly. It can make the spleen to swell. When the spleen begins to swell for sicklers, they have these symptoms. They have these symptoms. It will tell you that spleen is swelling. We have autosplenectomy, sequestration, that will take place. Renal papillary necrosis will take place. Acute chest syndrome will be seen. Chronic abdominal pain will be seen. Priapism will be seen. Osteomyelitis will be seen. Dactylitis will be seen. Recurrent leg ulcers or ulcers. And another one is called crisis for eating non-food items like plastic and whatever. That one tells you that your spleen has something called microphages. Microphages, these are the vessels that your spleen normally used to purify or cleanse your blood. You know, spleen is another organ that eliminates toxins. Where the work that kidney does, the work that the liver does, spleen also do part of that work of detoxifying the blood or blood purification. Now when there is the dead red blood, they may get into the spleen section called the microphages. When they enter the microphages of your spleen, they stuck into those vessels. Then the spleen stops its own function. When the spleen stops its function, the body begins to swell. Your body tissue swells up. When the body tissue swell, you can have mumps, legs, everywhere. The stomach goes big. That means the spleen is blocked. One of the things that blocks up your microphages is when there is too much red blood cells destruction. That will bring that one. Another thing that you need to know, there is balance between calcium and potassium. The other time I taught the balance between calcium and between potassium and sodium. But now, I want you to listen to this. It is important for you. There is balance between calcium and potassium as matter of hemoglobin is concerned. Within the red blood cell, when there is too much calcium inside the red blood cell, the positive calcium, if it gets into the red blood cell, there will be an efflux of potassium. We normally say when there is calcium influx, automatically it triggers potassium efflux, which means when potassium gets into the red blood cell, calcium, when the level goes bigger, increases, that concentration will trigger the removal of potassium within the red blood cell. What did I teach the other time? function of potassium in the cell? Can somebody remind me? Can somebody remind me? Oh, thank you. I forgot that I'm in Masinde Muliro. I've reminded myself I am in Masinde Muliro, where you don't speak with students. You only teach and you go home. I wonder how your lecturers do it. But I will sneak to ask one how they do it. Yes. Come up louder.
Water absorption.
Health?
In the absorption of water.
The absorption of water. Okay, here's a hint. I thought that the work of potassium is to retain water within the cell to maintain the cell turgidity. But the work of sodium was to remove water from the cell. It makes a cell acquire the flaccid state. Now, due to calcium-potassium balance, when calcium increases in the red blood cell, potassium decreases. When there is an efflux of too much concentration of calcium, there will be an efflux of potassium, removal of potassium. When potassium gets out of the blood system, do you know what happens? A dehydration will take place because due to low water content in the cell dehydrates. Any dehydrated cell become low in oxygen content, number one. Number two, it makes the hemoglobin to squeeze out to fill in the gap of which has been left by water. This will lead to sickle-shaped cell. But a question comes, what can lead to the increase of calcium concentration in the red blood cell? Number one, when there is low magnesium in the body, definitely calcium absorption will be low. So the body will not absorb calcium always. There will be a buildup of calcium in the system due to low magnesium. What can decrease magnesium? One of the components that decreases magnesium is known as purine. Where do we get purine increase? Where? Oh, you are shy, but you have an answer. As you are, you can be shy really, the way I know you. Can you come up and speak loud? Good. I said there is a byproduct of meat metabolism called purine. So as long as you continue eating meat, especially red meat, there will be an increase of calcium in the system due to the fact that purine destroys magnesium. Purine destroys magnesium. So when magnesium content is low, there will be an increase in calcium level in blood. Why? Because absorption of calcium will be low due to the fact that magnesium is low. So there will be a buildup of calcium. When there is a buildup of calcium, definitely there will be a potassium efflux. Dehydration will take place in the cell, leading to sickle-shaped cells. Then crisis comes automatically. High concentration of hemoglobin S will lead to depletion of blood volume. Blood volume. Acidosis. Madaktari wako hapa wanajua. Acidosis leads to low blood volume. Hiyo lazima ujue. Another one, they say that when hemoglobin produces valine, it forms a chain of bad protein, which leads to sickle cell anemia crisis. Under bad protein, calcium will go inside your cells. And when calcium increases inside your cell, this will prevent electronegativity of your cell, leaving potassium with no option other than to get out of the cell, leading to dehydration. That is not good. Now, let me conclude. You cannot give birth to a sickler, I'm repeating this, when both parents are not carriers. No, you cannot do that. I had told you that 2 of my kids are carriers. Me, I know all my kids. I know, because I have to conduct. From the eldest to the youngest. So I have only 2. I don't know whether I will have another one, but with my age, okay, I'm still thinking. But this is the truth. In order for you to give birth to a sickler, I need 4 people in front. I need 4 people. 2 male, 2 female. This time round, wewe umewahi kuja hapa kweli? Tai nyekundu. Angalia hii. So, according to Masinde Muliro, if you see these 2, this is equivalent to 2 males and 2 females. That is how Masinde Muliro is situated. Is. So, can you stand from behind me? I want to give you a picture simply because our projector cannot project, but I wanted you to have something like this. I want to give birth to a sickler now, and again I want to give birth to a carrier now, and again I want to give birth to a normal child, but now, not tomorrow. That is why I've called them. Now, among you, who is the father and who is the mother? Let me begin. The 2 of you, who is the mother? Oh. Okay, if she's the mother, you will be the mother today. Kama ungesema ni wewe, ningesema huyu. Kwa sababu umepoint huyu, sasa you will be the mother. Who will be the father among you? Where you also you know you understood what I've said here. So you want to beat me in my own game, right? No, I was lying. You are the father. So I have a father here. I have a mother here, definitely. They want to give birth to children. But this man is a carrier. He is like Ev.Lamech Osunga. This man is a carrier, but the lady is not. They want to give birth to children. The lady is not. During the time he is giving out the chromosomes, he can, for example, unfortunately, when the chromosomes he dispatched contain hemoglobin S, and the chromosome of the lady will always be hemoglobin what? Will always be hemoglobin what? Can I see loudly? That is how you people talk. Can I hear loudly? A, that is right. Now, the guy has gave hemoglobin S, that is protein with defect. Meaning, during the period you came together with your wife, your red blood cells were operating under hydrophobic site. If I speak like that, I hope you now know. Meaning that your red blood cells were operating under hemoglobin S. That is why your chromosomes contain the elements of hemoglobin S. So, you have hemoglobin S here. But because the lady is always with hemoglobin A, there will be a conception of a child here. This child will have how many types of hemoglobins? 2. One will be hemoglobin A. Another one hemoglobin S. Now, when there is hemoglobin AS, that is not a sickler, but that one is a carrier. The child will live without knowing that he is a carrier. Because there will be no symptoms at all cost. They live normal life as people. They don't even know that they are carriers. So that is this one. But when all of a sudden, the guy, during the time they were in a child, his body or his red blood cells were operating under hydrophilic state. That is, under protein without defect. Meaning, he must produce chromosome with which kind of hemoglobin? A. Because hemoglobin A represented glutamic acid or hydrophilic site. Now, to this time, he has produced hemoglobin A. The mother always had hemoglobin what? A. So this child here has two types of hemoglobins, which is what? Why don't you speak? A. So hemoglobin A represents glutamic acid. Now hemoglobin A would mean a living child without any trait of sickle cell anemia. She is not a carrier. She is not a sickler. She is normal, a normal child. Because during conception, chromosome from the father contained hemoglobin A. Because you are operating under glutamic section. The mother produced hemoglobin A. The child became A, a normal child. Now get back again. Your positions. During conception, this guy here, for example, this guy here. Oh, okay, no. Let me get it on the other way around. Now, she is a carrier, and he is a carrier. Carriers wameoana. Now, they want to give birth. When the conception came, the father released chromosomes with elements of hemoglobin A. The mother released chromosomes with hemoglobin S. The child will be a carrier, right? Are we together in that point? But on the other hand, the father released a chromosomes with elements of hemoglobin S. The mother released an element of hemoglobin S. The child has hemoglobin S. What is this child? A sickler, while this one is a carrier. I don't know whether we are together. This comes out a sickler. This comes out a carrier. That is why I told you, you can never give birth to a sickler if one of you is not a carrier. The moment you find that you have a sickler in your house, stop pointing fingers. Oh, imetoka kwenu. Oh, imetoka kwenu. Kama kwenu hakuna traits of sickle cell anemia, then it means huwezi kuzaa a sickler, but you will give birth to a carrier. The fact that you've given birth to a sickler confirms both of you that unfortunately you met carriers. So you come to Melewan. You may be seated. Now, sickle cell is treatable. Doctors will tell me, no, you're lying to us, because I know them, they are here. But I will confirm to you several times that you can treat sickle cell. What you cannot do, you cannot make a sickler free from traits of sickle cell. he will remain a carrier. You can reverse a sickler to acquire a condition of a carrier, but you cannot take him from being a carrier or a sickler. There has never been found that kind of method. What has been found, confirmed true, is how to treat a sickler to acquire a state of a carrier. Carriers do not have crisis. Carriers do not get sick. They can only get sick normally as a normal person can. So, great hope is that we can treat sicklers to remove them from the condition of sickling and crisis. Even though it is a program that runs for 6 months. The best way is when they come to the sanitarium. That is why one of the diseases that made me to put up a sanitarium is sickle cell anemia. I was really disgusted. They come to you, you give them medicine, they go, they don't get well, they come back, keep on coming back to you. Then I said, no, what should I do? What I did first, I decided and took one and stayed with in my home. And I took 6 months with him at home. He went back to their home a carrier, but not a sickler. Then I said to myself, I must have a facility where these people can come and stay. They go when they are okay. It is possible you can treat sickle cell anemia. Who has a question? Concerning sickle cell. How I hope, or how I wish that one microphone would be on this row, another one in this row, and then we have two gentlemen who their work is only to take those microphones wherever they are needed.
My question is...
Let microphone be away, a bit away from your mouth, yes.
Okay, my question is the couples are both carriers. As the latest case you illustrated, is there a way that you can be sure that if you live a certain kind of life, you can never give birth to a sickler? Thank you.
That is why in my introduction to this lesson, I say that one of the diseases which people neglect during the time they are engaging themselves is sickle cell anemia. They will conduct tests for HIV. They will conduct tests for STIs, even hepatitis B's, but they will never think of conducting a test for sickle cell. If you had known that both of you are carriers and you love each other and you are determined to get married to one another, do not get disappointed. Go ahead and marry. If you will find somebody who will sit you down and teach you how to give birth to normal children when you are carriers. And I've already given an answer here. That man released some chromosomes when his body or his red blood cells were operating under hemoglobin S. Can you remember? So, hemoglobins have two sides of operation. They operate both in glutamic acid and the valine acid. Now, if you want to be sure, during the time your body's acid levels goes up, hemoglobin change automatically from the site of glutamic to hydrophobic. It changes automatically. It's like a clock. Changes automatically. Now, I am a carrier. My wife is a carrier. We want to give birth to a child. Number one, we have to understand by the time of the conception, the condition of our system is like what? What do I mean by that? We must ensure that the pH level of our blood is very normal. It is not acidic. It is not alkaline. Are we together? Then we must understand that if the condition of it is very simple. Sio kwamba ni kitu kubwa unaenda kutafuta nje. It is simple in that any time when uric acid is up, calcium concentration is up, acid level is up, your hemoglobins will stop operating in the glutamic site, then it goes to the valine site. At that time, the chromosome that you will be producing during the time your body operates under hemoglobin S will be hemoglobin S. Sijui kama tumeelewana. It is simple. Sio kwamba ni kitu unaenda kwa daktari kutafuta. That is why I said mukijua kwamba huyu ni carrier and this one is a carrier. So you will know how to stay, when to give birth to a child. During that time, you examine yourself well, not to give birth to a sickler at all. Another question was
a question on this side.
Yes, I have a question. You said that if purine and uric acid increases in the body, this can lead to increase in hemoglobin S. So the question is, if you are a normal person, not a carrier, can this lead to development of a carrier?
It cannot get you into being a carrier, but you will sometimes undergo anemic state. Do you think I taught we have anemia due to decreased blood volume and sickle cell anemia. Now, in that condition, your blood volume may decrease. And if that happens, you will suffer anemia, but not sickle cell or being a carrier. Yes?
Okay. My main question is on how to keep yourself in a condition.
Is that your voice? Ama ni ya mtu mwingine pia mmeongeza pamoja?
And Mara.
So reduce nini kidogo.
Okay. Okay. I have a question. My main question is on how we can keep ourselves, our bodies in that condition. I don't know those terms. I am a student of money. So that was hydrophilic, I don't know, and hydrophobic. But there is one condition that is good for the body, and there is that other one that is a little bit dangerous to the body. So is it only in terms of diet or other things also can contribute to these particular factors that can lead your body to be in a condition that when you do, you understand the question.
Anything that increases acid level in the system will do the same. Anything that will increase uric acid will do the same. Anything that will lead to calcium malabsorption will do the same. So it is not only the other thing. So that means you will check on your diet, you check on your lifestyle, you check on how you put on. Praise the Lord. Did you know that wrong clothes lead to sluggish movement of blood? Let me say, for example, I was not blessed with big body. Who is a bit, nani ana mwili nzuri hapa? Show me somebody. Nataka tu kudemonstrate. Nani ana mwili nzuri hapa? O bado ni huyu mwenye tai nyekundu? Mwenye tai nyekundu kuja? Huyu ndio mnasema ako na body. I need somebody mwenye ako na body. Okay. Are you free if I remove your coat or you are not free? There is no danger in that. You can now remove it. Aha. Kumbe wewe uko na mwili. Nilikuwa nadhani hiyo koti ndio ilikuwa. Just put it there. So, kumbe huyu ako na nyama bwana. Okay. Stretch forth your hands. Have you ever met men with clothes of this nature? Umekutana nao? If you have a tight cloth that tightens your body, there is what you must understand. During hot weather condition, veins dilate and they come out. In cold weather condition, they contract and goes deeper to the skin. Is that true? Is that true? Do you know why they move that way? I taught about 2 types of conditions. I've repeated it several times. Exothermic reactions and the endothermic reactions. Now, when the body has been tightened this way, in hot weather, the veins will tend to come out because they do not allow that kind of temperature that they are passing through. So it means they will try to come out away from that endothermic temperature, that reaction. But at the same time, your cloth ties them back, obstructing their movement and their dilation. This forces your veins to remain in that abhorrible temperature. Do you know what makes your veins to be elastic? This is called the venal linings. The venal linings may corrode when they are exposed in high or extreme temperatures. Now, when the venal linings corrodes, it leads to heart problems. It leads to sluggish movement of your blood. When there is a corrosion in the vein collapses. It loses elasticity, never to expand again for enough volume of blood to pass through. This leads to a sluggish movement of your blood, which is a problem. When there is a sluggish movement, number 1, circulation of oxygen decreases. Under low oxygen, I mentioned under deoxy. Do you remember? Under deoxygen, under low oxygen content, sickle cells will squeeze to try to fill the gap which has been left due to low supply of oxygen. This leads to hemolysis, the mass destruction of your cell. That is just as an example. That is just one example. Ziko nyingi. Ninashangaa unaona mwanamke amevaa kitu hapa hivi. Iwe no wako gisabuni. Sometimes let me tell you something. Tight clothes are the best methods that the devil is using to destroy our men and women on earth. Did you know that the devil understands anatomy and physiology of your life better than you do? Did you know that? So he knows how to destroy you. Right now there is this kind of temperature. The temperature is not now favorable now. I need a sweater now. But you will find msichana wa wenyewe anatembea hapa nje na nguo ambayo hapa ni kamshipi tu, hii ni naked yote. Kamshipi tu imeshika hapa na 3/4 ya matiti yote imekaa nje. Na alafu siku hizi wako na kijukuu ambayo utashangaa hata kama matiti zilikuwa zimeenda kando, inaichukua inaleta hapa hivi. You think that huyu ni dem kweli. There is nothing there. toa kijukuu uone. Nothing. But at the same time, they expose these extreme areas. This is we have areas in the body called the extremist parts of the body. The extremist parts of the body are the most vulnerable due to cold weather. But because the devil understands your anatomy and physiology better than you do, he has designed clothes that will expose your extremist areas. One of your extremist areas here. Why? The devil understands this is the position of your lungs. If I expose it to cold, I will constrict the veins running through your lungs. The constriction ikikuja, then you will have respiratory problems, lung problems, among others. Then, wewe kama daktari, you as a nurse or a doctor, you know something called stethoscope. All of us understand that. When I want to identify the four sounds, si unaelewa? The four sounds. Where do I place my stethoscope? Why? That is the position of the organ. Ni focal, unapasi what hapa? Good. So I can use you better, right? Now assume that I've placed the stethoscope now. I want to check whether you have a burning bush sound, a gravitational sound, a Honda sound, or a whizzing sound. I want to understand so that I confirm the state of your respiratory system, right? Now, if you are a female, where do you put this one? Here for lungs only. Where do you put that? That is true. Hata kama matiti kubwa kiasi gani mimi sijali. I will not bother that. Itakwambia beba, usipobeba na kubebea. All I want, nitaiweka hapo. And until breathe in. Why don't you do what your patients normally do? Do what they do. While breathing in, you close your mouth. Breathe in. Out. When breathing out, you open the mouth. Now you know what is happening. Now do it. In, out. In, out. Why do you think I put it here and I tell you, breathe? I want to understand exactly the kind of sound within the lungs. Then I will tell you, geuka. Ukivaa hivi nitatoa hivi. Nyinyi mnatoa aje? Hivyo tu. Then I place it here. The same process. I place it here. The same process. Because the lungs reflects itself from the back. Both two lungs. And those are the area which the devil normally exposes. Kuna kamishipi hiyo imekuja hivi tena hapa ni bure yote. Nakuja hapa. Kweli hao uongo. The devil understands you. So, not only those things, my brother, you be seated. Even how you put on. Ni muda tu ndio hatuna. Kama tungekuwa hapa na muda, tufundishe vile tight skirts inaua wasichana, tight trousers inaua wasichana wetu. Wengine wangesema Mungu nisaidie tu. But bad luck, we don't have that time. Furthermore, a woman needs circulation more than a man. Because women, they have discharge 24/7. Do we have the same? See, I'm asking you. Women have discharge. They have colorless discharge. Kwa wale ambao sio wagonjwa. That moist needs circulation of oxygen. God is not a fool to give me a trouser that closes everything and give you a skirt and a full dress that will expose your genital organs to oxygen. God is not a fool. God knows what he did. So in as much as you think you are civilized, you are dying even the more. Other question? Yes.
Happy Sabbath.
Happy day.
So, last year, around April, we were having a youth week of prayer outside of Matungo, near Mumias. I met a family of sickle cell where both parents are carriers. Their children were so inactive and they were moodless, something like that. Most of them were sicklers and they were even vomiting blood. And there were some blood stains when they were passing stool. So I fail to understand how comes they were vomiting blood. Perhaps you can explain how comes a sickler can go to an extent of vomiting blood and even the stains. Then how, if that can be reversed or if that can be treated, that is one. Then two.
Don't go to the second one. You know my talent. I had communicated. The best talent that I have in the world is called forgetfulness. So ukiuliza mbili nitasahau. Ngoja nijibu hiyo alafu ulize ile ingine. Praise the Lord. So according to what I gave under extravascular hemolytic anemia, I gave you some symptoms. Among them was ulcers. Acid level is at a constant for a long period.
Plant-based wiki and beans that increase acidity level.
I'm sorry, I have not taught management of sickle cell anemia, which was also very important. Macho yangu sasa hayaoni. Ukiandika maandishi madogo, huyu ni mzee. Kusoma kwangu sasa inakuwa shida. Kama tungefundisha how to take care of sickle cell anemia, there are some food stuff which anemic patients must stop taking, like sugar, completely sugar, raw salt, anything called cola drink. There goes with sodas, quenchers, and what have you. Any acidic substance, anything that raises acid level X, that one you will control the patient. You will even reduce crisis, even if you don't go, you've not started the management. You will reduce the level or number of crises when you begin to avoid things that increases acidity in the patient or sickle cell anemia. So it is true you can avoid. Is black pepper harmful to the body? How can one help a person who takes too much salt? How to conceive twins? Black pepper is not bad. Black pepper is not good. Taking black pepper moderately is beneficial. Taking too much black pepper irritates your intestinal lining. How can a person help? How do we help a person who takes too much salt? Tell him to stop taking salt much. That is how you can help. Just tell him to stop. Do you know something, brothers and sisters? Brain is is something which is very complex.